It's time for another new Kansas City Spotlight.
For so many in the Kansas City area, the search for safe and effective treatment of their depression continues to be a challenge. But thanks to the revolutionary technology of TMS, Sunrise Psychiatry is changing lives. I caught up with the team at Sunrise to hear how they're making this all possible. Okay, so we're joined by psychiatrist Dr. Sunny Elliott and TMS technician Olivia Wortman. Thank you guys for letting us come in today.
Thanks for coming.
Okay, so let's talk about TMS, and is it similar to like ECT or even shock therapy?
No, we definitely get a lot of questions about ECT and what some people know as shock therapy. I do believe that part of that is there have been very, very few procedures that are carved out within the area of psychiatry used to treat mental health conditions. And you know, we do acknowledge that although ECT is considered the gold standard, for treating a number of conditions, it does have a rough history, right, in terms of the way that people were treated, you know, over the decades. ECT is actually giving people controlled seizures under anesthesia. TMS, which is transcranial magnetic stimulation, is not. We are literally here in my office, and this is the treatment room. It uses a very targeted magnetic pulse to one of the areas of the brain that's affected by depression.
And I'm sure you've gotten this question before.
Yeah.
Does it hurt?
That's a great question. Olivia, do you want to take that?
No, most of the patients that we have always said it generally does not hurt. It feels like somebody is clicking a ballpoint pen on their head or kind of just tapping on their head. Some people like to say it kind of sounds like a woodpecker, but no, we do not get that it's painful for most of our patients.
What about, are you awake during it?
Yeah, so you're awake. Most times I am over here with you just chatting. We're talking about as many things as you want. Sometimes we're watching movies, shows, really up to the patient, but you are wide awake during the treatment for those 20 minutes.
Okay, so 20 minutes. That was going to be my next question, how long it takes. Is that typical for outpatients?
So we have a couple different protocols that we do here at Sunrise. So the main one is the standard 19-minute protocol. That's the one that's covered by every major carrier, including Medicare and Medicaid at this point. But there's also a 10-minute version and a 3-minute version that would just be discussed with your insurance carrier and seeing if that's covered for your specific plan.
We would love for people to reach out to our website or call in our office directly.
This Kansas City Spotlight has been paid for by Sunrise Psychiatry.